unfortunate. It's not technical. It's not technical because it's quite unfortunate that we are facing such a situation. So more than half of the lives lost are from Kerala, and majority who are under treatment in different hospitals, they are from Kerala. So it's quite unfortunate that we didn't receive that consent. So it's not a new thing. We have many precedents. So many previous governments had given that consent, the political clearance. So it's quite unfortunate. Nothing more to say now, because you can see how can we see such a situation? How can we face such a situation? Our brothers, they are being brought. Their mortal remains are being brought here. It's quite unfortunate. So nothing more to say now. Actually, embassy had not given an exact number of how many injured, how many seriously injured. So from the data we collect there, we are informed that about 7, they are seriously injured, and out of which 4 are from Kerala. Again, that is not officially declared. So actually, this is my visit, or my purpose of the visit was for being with them, to intervene in their needs and necessities, and to bring their needs to the attention of the Union government.
Also visited 5 hospitals where there were around 32 to 35 patients who were being treated of Indian origin who were injured in that fire. And we spoke to them individually, we inquired about their health, and all the hospitals and the directors were there. And I would also like to thank the hospital staff of each hospital that exceptional care is being taken by the hospital staff and the doctors of those patients. And most of them are likely to be discharged in a couple of days. Victims are from Kerala and surrounding southern states. Those remains are being offloaded here. The remaining will be offloaded in Delhi, and then from there they'll be transferred to their respective homes. People who were injured in this incident, they are in hospitals in various, and they have been put in 5 different hospitals, which are the best hospitals of the country. And we visited all the 5 hospitals, and we met with all the injured people individually, each and every one of them, inquired about their health, and the doctors and the team and the directors of the hospital were accompanying us to each patient, and individually we inquired about their health, their well-being. We took stock of the injuries, how long will it take them to be discharged. So there were some with fractures who had jumped from the 2nd floor or the 4th floor. Obviously, the fractures will take some time to heal. They will be in the hospital for a couple of weeks. But the other people, other persons who had inhaled smoke and had harm, and lungs were harmed to some degree, I'm happy to say that they're recovering very rapidly, and most of them are going to be discharged in a couple of days from the hospitals. There were 3 people in the ICU, of which 2 are recovering in the proper way. And there's 1 person who the doctors will be keeping in the ICU for some time. There's just 1 person who they are very hopeful of recovery, but it will just take a bit longer.